Good afternoon and welcome everyone. My name is Jarryd Hunter. I am the team leader of Enterprise Spatial Solutions at Spatial Vision. It's my pleasure to welcome you all to today's event, which is Visualizing Women's Health, Improving Outcomes with Digital Mapping. Thank you for making the time to join us, and we hope that you find today's presentations and the discussion valuable. As we gather today, physically dispersed, let us take a moment to reflect on the meaning of place, and in doing so, recognize the various traditional lands on which we are all tuning in from. I invite you to introduce yourself in the chat if you're so inclined and let us know where you're joining from. I am speaking to you today from the land of the Kulin Nation peoples. I'd like to acknowledge the elders past, present, and emerging of all the land we work and live on, and the ancestral spirits with gratitude and respect. Today, we're joined by a number of people. First up will be Safe Steps. From Safe Steps, we have Rita Butera and Paige Kernebone. Rita is the CEO of Safe Steps. Rita is an experienced executive with a demonstrated history working in health, welfare, and social sciences sectors. For over 30 years, Rita has worked across nonprofit organizations, state and local government, as well as health promotion. Paige is a client services administration and project officer and has a background in health promotion. Paige is committed to supporting gender equity and family violence response and prevention. Currently at Safe Steps, Paige helps coordinate various projects that work towards increasing the quality and efficiency of direct service. Together, Rita and Paige will discuss how Safe Steps' need for a searchable database of confidential information resulted in a lightweight and secure web mapping application that has helped its call center operators relay accurate, up-to-date information to those who need it most. Following on from Rita and Paige's presentation will be Amelia. Amelia Busuttil is an Education and Community Engagement Officer at Children by Choice. Amelia is passionate about women's health, sexual education, and gender inclusivity. She currently assists the education team at Children by Choice, facilitating professional training and co-design workshops with community groups. Amelia is completing a Master's of Social Work at the University of Queensland, specialising in healthcare, women's rights and domestic violence. Amelia will be presenting on the recently launched Children by Choice online database, featuring over 100 abortion and contraception providers, pharmacists and sonographers across Queensland. The Abortion and Contraception Services Map provides a clear pathway of information and options to health consumers and supports healthcare workers to confidently refer clients to appropriate services. Finally, we'll be joined by Tom Hollands, who is a senior spatial consultant at Spatial Vision. Tom is a technical specialist and consultant skilled in web mapping and development, as well as GIS and spatial analysis. He has extensive experience working with not-for-profit organizations on technical projects, pairing modern technology with sound advice to help organizations make the most of their data to meet their objectives. Tom will provide insight into the technology and processes undertaken in designing Safe Steps and Children by Choice, but also demonstrate a couple other successful web mapping examples. Just a few things for today. So this is a Zoom webinar. As a result, you're automatically muted, but that doesn't mean we don't want to hear from you. Please feel free to use the chat functionality to share your thoughts and make new connections while you're here. We're joined by people from across the country, so we encourage you to make the most of that. Any questions of our speakers, please use the separate Q&A function, and we'll have time to answer some questions and discuss at the end. So first up is Paige and Rita, and I will hand over to yourselves to share your screens and begin your presentation.
Okay, thank you for that, Jarryd. Look, I'll also acknowledge traditional custodians of the land that we are meeting on and pay respects to our elders past, present, emerging, but also to acknowledge that sovereignty is never ceded, and also to acknowledge for Safe Steps in particular the women and children that we who have lost their lives to family violence, but also those that we're assisting every day. So welcome to everybody, and thanks for the opportunity to share some of the work that we're doing at Safe Steps. Just a little bit of background. I've been at Safe Steps for nearly 3 years, and Paige probably not far behind me, really. And it's Victoria's 24/7 Family Violence Response Centre. Its focus is crisis response, and we run a few things like the portal to access refuge accommodation and access to crisis accommodation, mainly, unfortunately, tends to be motels as well as refuges. As I said, the refuge portal, information referral, and in Victoria, we're mandated by law to use a particular assessment tool called, it's a multi-risk assessment tool called MARAM. It's prescribed by law, and Safe Steps is a sort of specialist family violence service that undertakes MARAM assessments, safety assessments with all callers, and undertakes safety planning in doing that work. The thing that's unique with Safe Steps is a 24-hour, 24/7 phone response service. And as you can imagine, there's a lot of crisis work that happens in the after-hour space when everybody else closes down. It's really important for Safe Steps to, it's a very elevated, it's a very high activity kind of volume as well. We can get anywhere from between 200 to 300 calls per day at the moment, which is quite high, difficult to manage. And we can have anywhere from 100 to 130 women and children in motel accommodation. This is in addition to refugees, every single night. So it's a high volume, and data is really critical so that we're on top of things, and what we're doing is relevant, accurate as well. So it's a little bit about Safe Steps. Thank you. I think one of the things to say when I started at Safe Steps, I was absolutely shocked at the volume of work that was going through that place and the passion of the staff, and you know, the kind of chaos in the phone room. I don't know if you can imagine it, but to learn more about Safe Steps and how it operated, I would sit in the phone room as the new CEO to sort of get a bit of a sense of the calls and how the staff were sort of handling and how they were coping with that. And it was quite unbelievable. I was astounded at the number of places that each operator went to find up-to-date information. There were whiteboards everywhere. There was cross out and updates on things. There were motel lists on hard paper copies. People on the phones were Googling, you know, some of our staff were from overseas. They didn't even know where an area was in Victoria. And, you know, just seeing some of that dynamic on the phone, I thought, oh, I'm sure it could be improved. And, you know, Google for maps, a few versions of the truth. It took a lot of time, and we're a crisis service, and that time is really important in that service. And so they were sort of some of the triggers in my mind about, you know, what opportunity is there. And having come from Women's Health Victoria and being familiar with the benefits of, you know, geomapping kind of products with a few other things that were involved in there, I started to think there's got to be a way to map these services and keep them up to date and make sure that it's designed to meet the practitioners' need in that crisis. So that was a bit of the driver, and that started the conversation where we invited Spatial Vision around a table with a few other practitioners to really just talk about what possibilities. And I think one of the things that was really critical is that it was a co-development kind. It was really, the practice helped inform what we needed, and that consultation with the staff about what they needed was really important, because whatever we built, we wanted to make sure it was being used. It needed to be applicable, it needed to be easy to use. And so there were some of the things that we were looking at. Now, probably if we go to as I said, information systems weren't working very well. The immediacy of information was a real challenge, being a crisis service, and up-to-date information was critical. Version control, we have shift workers, notes from shift to shift, those sorts of things. Things could get missed, things could get out of date really quickly. There could have been a crisis, an incident at a motel. It went from being active to not active. How do we get that information across to new practitioners that come in on midnight or something like that? So that there was a little bit of chaos. It worked, but it was clumsy and it was time consuming. And I think that was identified as, you know, we needed to fix. So, yeah. So the after, and I will pass over to Paige to talk a little bit about this, because Paige has had such a lot to do with the development and that input from clients. So I might pass over to Paige.
Thanks, Rita. Hi, everyone. I'm Paige. So yeah, following on from what Rita's said, we worked really closely with practitioners and the Spatial Vision team to develop this product that was going to be the most useful to our frontline staff. I've got a little screenshot here of the map, but I'll also do a demo just in a moment. But the benefits to it were very clear very quickly, because we got to visualize our data. So the tool enables the visibility of motels, even unsafe areas around particular locations. It was also helpful for staff who might not be 100% familiar with, suburbs and where they're placed. Being able to visually see that on a map is just really, really important, especially in the crisis environment. It also gives us the ability to control our information a lot better and have a central and reliable kind of reference point to all of our information, instead of it being kind of spread out. And yeah, overall, it really just supports the practice efficiency and contributes to the outcomes for victim survivors and their safety in all of the work that the frontline staff do. Another benefit of it was we hadn't planned this, but before the workforce was kind of went to more working from home remotely, it was a very helpful tool for that as well. It made the transition a lot easier. Instead of having all these different sources of information, they could just log in from home and open this up and have all the information there. So I'll show you a little demo.
I think it's just for the demo we've changed names of motels and things, because this is all highly confidential data. Yeah.
Yes.
Yeah.
So motels and all kind of information has been randomized and everything. Can you see the screen? Is that all good? Perfect. Okay, so this is kind of what the frontline workers see as soon as they open up the tool. And as you can see, it's like a map of Victoria. It's got a whole bunch of filters on the left-hand side. An example of how they can use the tool would be, say a practitioner took a phone call, assessed the caller at serious risk requiring immediate protection. Obviously, they're going to see if they can find an emergency accommodation motel to place them in for the time being. So say the caller has a pet and needed a smoker-friendly motel, they would simply just toggle on and off what they're looking for. So they'd toggle off all of the services except for motels, so they can only see motels on the map, and then they can even filter it further by clicking pet friendly and smoker friendly. So that just leaves us with the motels that provide that that service. They can then use a search function at the top to enter in relevant addresses. So say the person using violence or the family home was in Coburg, they can enter that onto the map and create an unsafe area, or like a radius around that area to visually see the unsafe area. And they can put in multiple search points. The location can be very specific as well. I'm just using suburbs as an example. But say the person using violence was worked in Caulfield, they can also enter that into the map and put a radius around there. And that just shows, very, very easily and very visually what motels would be appropriate to place the caller into. Once they've completed that step, they can, click on the they can click on the motel and it brings up an information panel with all of the details about that motel. So there it's got, you know, all the address, area, phone numbers, all kind of specific details about that motel, whether it's, you know, got a kitchen, parking, outreach details. It's also got, you know, nearest supermarket, nearest pharmacy, nearest bulk billing GP. So it's really easy for the practitioner to find that information quickly rather than, you know, Googling everything and looking at lists of all that stuff. Another great function of the tool is they can create real-time comments on any particular motel. So that's really helpful if, you know, something's happened at the motel or the motel, you know, requires something, they can just enter it into a comment so everyone, all of the frontline staff can see that bit of information. We can also delist motels that might not be online for a period of time. So if that were to happen, we can delist them and it shows clearly on the map that they're not available at that time. Another good use of the tool would be if the caller or the practitioner was, you know, assessed the caller as at risk, but identified that a referral to the orange doors was appropriate. Say that caller's location was in Caulfield, they plotted Caulfield onto the map and clicked the pin. It opens an information panel about the relevant orange door to that location. It's also got other services that are relevant to that location as well, such as after hours outreach, socket teams, and cat teams. God, there's so many great things about this tool, but another thing is you can toggle on and off DHHS regions and LGA boundaries. So if you're, you know, had a particular point and you needed to know what region or what LGA it falls under, it's just very simply toggling on and off these up here. So I think that's kind of a good overview of what the tool does. It's very user-friendly. Let me get up the slides again.
And I think the other thing to add, if people see the additional filters, there's many times where we need a 24-hour reception, or you know, there's full accessibility, there's those sorts of things that we can put into. And again, this is informed by practitioners, and there's always room for improvement. You know, they've got a wish list actually. Don't you have a wish list, Paige?
Yes, there's so many things that we can add, like child protection, divisions, housing entry points. So there's, it's great that it has the ability to add on to as we go as well. So that's it. I also just included, the staff were very, very excited about the tool. So during training, I collated a few of the emails that were sent through, but for example, one of the practitioners said, "This is such an amazing resource. I'm so excited for it to go live. It will save so much time and confusion on the floor." The practice lead also said, "The Safe Steps web map has revolutionized a major part of how we do our work. Being able to easily navigate multiple search points while viewing accommodations and emergency services with all the crucial information provides such a critical time saver for us, meaning we can facilitate people getting to safety quicker." I've also heard that, like, when practitioners just start, so new staff members, they're just absolutely, they love it. They think it's, you know, more organizations should have similar tools, and it's been a very overwhelmingly positive response from the staff.
Thank you, Rita and Paige. That was a great presentation. Over to you, Amelia.
Thank you so much, Jarryd. I will just share my screen and set myself up a bit. But I am All right, I feel like we're all good. So I am Amelia. I'm from Children by Choice up in Queensland, and I'm super grateful that I've been asked to speak at this about our map, because I think it's such a great tool that I want more people to know about, especially because we only just recently launched it. But I would just like to do a acknowledgement of country. For Children by Choice would like to pay our respects to all the traditional owners of the land on which we meet today. I'm on the Turrbal and Yagara people up in Queensland here, and we pay our respects to elders past and present. So I just kind of wanted to give a bit of a context around Children by Choice as a service, because we're a Queensland service, so maybe some people aren't familiar with us. Children by Choice has been around for 50 years this year, so that's really exciting for us. We're celebrating our anniversary, and we have some celebrations at our conference towards the end of the year in August. We provide non-directive pregnancy counselling, mainly via telephone. However, we do some face-to-face in our Toowong offices. We support women and the pregnant person to make autonomous decisions around their sexual health, and including sexual and reproductive health, including pregnancy and contraception. So we have two teams within our organisation. We have our counselling team and we have our education team, which is what I'm a part of. Last year, we assisted 1,573 clients with our counselling services, and this is increasing with access challenges still occurring. As the ed team, we do a lot of professional development kind of things and tertiary education with uni students, and so that's a big part of what we do. And I will move on to kind of some of the details about the clients we kind of see. So the demographics we generally see tend to come from culturally and linguistically diverse backgrounds. They've experienced violence or from an overseas student population. This is because it's generally harder for them to access abortion providers. Things such as language and not having Medicare and experiencing violence can make those things quite complex. So we tend to see them quite a lot within our data set of clients. And I will move on to how our map has kind of helped with this. So we launched the map last year. I just put the QR code if people wanted to get it, have a look on their phones. So the map with co-creation with Spatial Vision has really helped us to help our clients access. So it's a client used tool, I would say, but it also has an no, I can't say it, I don't know why. But we also use it on the back end within our counselling team, operationally, we have kind of a public and a private setting. So the public setting can be seen by our clients when they Google us, and it's right at the front of our webpage. And then the private side, when providers don't want to be seen as public, so that not everyone can see where they practice, I guess, we have access to that. So if they're a caller and they're still a provider, we can give that information out, and which helps clients as well. But most of our providers tend to be on the public side of things, so that that really improves access. So if everyone's had 1 second to get the QR code up, I will show a bit of a demo, just as Safe Steps did, of how we use our map. 1 moment. So when you enter the website, this is the first page you'll see. And so you'll hit, if you're looking for the map, you're wanting to find a service, you can hit find a service, which is super easy if someone's looking for it. And so you can see here that we have a list of our providers. So say if you can put in, depending on what you would need, you can put your what gestation you're at, whether you're looking for a medication termination, or you want maybe potentially surgical options, then I would put in a postcode. So Toowong is 4866 here in Brisbane. So you can see that There's one at Murray Stopes in Bowen Hills there. Within, I can change the radius. So that's a 5 kilometre radius. So say if I wanted a 20 kilometre radius, that would change the different services that you can see. You can see that if I wanted to look at all of the different kinds of contraception options that were available around me. And this really depends. So you can look at gestational limits in that abortion feature too. So contraception, you can see where you can get different kinds of contraception. If you want fee information, so there's things like the Medicare rebate, whether or not you can access that, healthcare card holders, non-Medicare card holders. So that's really important for our overseas student population, and private healthcare. So for those who have it, they can look that up too. Other services I think that are really useful, especially in the pathway for abortion services. So trying to find where you can get an ultrasound is a requirement of getting a termination. So you need to get a blood test and an ultrasound, so you can look that up, and pathology. So it really helps you to piece together a pathway for yourself. And that really means that clients, if they don't want the decision-making counselling, which we provide, they can generally access their pathway, well, kind of what they would need to do through the map, which really helps, I guess, when I consider the map, what I think it's super important. Why I was always like, oh God, like, what would you do at 2 a.m. on a Saturday night when you're out? Maybe you've realised you haven't had your period in 6 weeks or something. You can go, oh, where would I get an abortion in Queensland? And this would come up, and then you can put in your postcode and you can see kind of what's available around you. And kind of when we're not open, because we're only open on Monday to Friday in business hours, that gives some solace, and it really reduces that distress in clients, so that they can kind of have some information at least before they come to us, even if they still do, or they maybe can get the information that they want on their own. So we're really trying to not be the holders of knowledge, as we like to say, because that's really not helpful. As you saw, we only really see around 1,500 clients a year, and we know that people looking for termination services are a lot more than that, around 10,000 in Queensland a year. So we want to make that as accessible as possible, so that it's a really clear journey. And if it's not clear and the decision is, they want to discuss the decision, that's when they can really come to us and we can really flesh that out. So other search criteria, you can see Indigenous services, self-referral, so no GP referral required. You can select that. A female doctor, bilingual healthcare, so that's really great for our called clients. Wheelchair accessible, so that's really good for accessibility to people with wheelchairs. Youth-friendly and LGBTQI safe, and I guess type of provider, you can also select whether you'd want to go to a hospital, see a pharmacist, like you can pick where you would be able to get these things along your pathway, imaging, things like that. So it just really makes it a lot easier for our counselling team, but also our clients, so maybe that they don't have to access us. And also in terms of providers joining the map, before we had the map, we were basically, each person was the map in the counselling team. So they knew each pathway, they knew what things were happening in each HHS district. And they were really the ones, I guess, like we have another software that, we can look up, but really they were the ones holding a lot of that information. So since we've got the map, that means that they can look at this. It's really great for that, I guess, if you have that staff turnover where you can teach someone how to use the map, and that's really a great basis for staff as well. And then for providers to join the map, you can register your service here. So that just takes them to like a Qualtrics kind of a thing. Oh, no, I can't go back. Yeah, and so it just means that if you want to register your service, it's very easy once seeing the map, or going like, oh, look, like there's this many providers, I want to be a provider. I'm now, or if you are a provider, you can go, well, I want to be seen on this map. So it makes it quite clear how to do that. And then that just kind of happens through our systems. You know, they say they want to be a provider. We make contact with them, and then we can upload them to the map that way. I'm just trying to think if there's anything else. I think in terms of how it's changed our service delivery, I think it has really reduced that staff stress, as Rita was talking about, because there isn't that chaotic feeling of like, oh, like I have to help every single person to, you know, that's calling to find a pathway. It's they've got some autonomy and things like that for the client, that they can go like, look, this is, I've looked you up on the map. If you want to refer to this later, you can use our map. Or and really what we're seeing now is that our clients that we are interacting with on our phone lines are those more complex cases that really require more capacity from our counsellors to really go into that counselling process and giving them that time, holding that space, all those lovely counselling terms. And that requires a lot of time. And since having the map, we don't have as many calls just requiring access information of where they need to find a provider, which really was only taking a little bit of time. But because it was a voicemail coming in, we had to call them. If they didn't answer, then we've got to call them back and see if they're, you know, we've got to do that whole liaising process, which all accumulates to a lot of staff hours. And now it's really more that we have an intake officer. If they need that kind of counselling, they can, if they've looked at the map, they might know a few of their options, but they want to talk about it with someone, they come through our intake, then they book in time with our counsellors, and the counsellors have a lot more, I guess, structured day, which I think has really helped with stress levels as well. And I think it's just nice that I always just think about if you're out of hours, because we're not a 24 hours service, like Safe Steps, that I want people to feel some lessening of distress in those out of hours times, because I know finding that potentially that you're pregnant or you know, you're wanting a contraception option really quite quickly, and you really want to know something about what you can do in that moment, I think the map really holds that space really well for them. I will just finish up with coming back to our slide. Just if you want any contact information about our service, and, you know, if you want any training and things like that, yeah, this is our QR code, which will take you to a link to all of that. But thank you so much, Spatial Vision, for all of your help and helping co-create a map that's so useful for us up in Queensland. And yeah, thank you so much for having me.
All right. Thank you very much, Amelia. Just a reminder to everyone to start popping in some questions in the Q&A section, and we'll get to them after this final presentation. So I'll just share my screen again. So next up, Tom is going to talk about technology and design of these mapping systems. So he may not mention in his talk, but Tom was the lead developer on both the applications that you've seen presented so far. So take it away, Tom.
Thank you, Jarryd. Yeah, so I'd like to spend my time here today to take you through a couple of the things that we've learned from building these applications from a technical perspective and also from a mapping perspective, and consider a couple of different approaches to mapping and how they can be used in the health space. And then finally, I'll just give you a quick demo of a couple of other applications that we've had the pleasure of working on. So yeah, thank you, Jarryd. Perfect. So I'll just take you through a few points, a few sort of principles that we use when approaching these sorts of projects. So this is really echoing a lot of what Rita said, reflecting on that build and design process. So the first thing I'd like to underline is to design functions from user stories and not the other way around. So the sort of subtext of this comment is that you really need to engage with your stakeholders and understand what you're trying to achieve before you actually set out and start doing it. You know, the truth of the matter is that, you know, we're not going to probably, the the application that you imagine is not always going to be the one that's going to be best for you. And when we're working in this space with, you know, not-for-profit organizations that run on grant funding and things like that, there's a large emphasis on efficiency and being able to, you know, first of all, build the thing that needs to be built and to deliver it within, you know, an appropriate budget. And that is going to keep being useful for the future. And the first step in that is really understanding what needs to be done to get you to a certain point. And that leads into the next point I'd like to make, which is to build gradually. Basically, you know, we're all human and we're not going to get it perfect the first time. So the best way to approach problems like this is to really try to focus on that minimum viable product and the thing that's going to have the most impact for you as an organization. So Rita spoke about her time in the call center and seeing all these processes that were, you know, weren't as efficient as they could be. And so like identifying those things and trying to fulfill those main uses is the best way to build a sort of resilient mapping product in the end. And of course, as time goes by and use the application more, you know, 1 year down the line, 2 years down the line, you'll know a lot more than you did at the start. And you can really feed that back into the process and try and improve as you go along. And then the final point I make before talking about mapping in a little more detail is that you should try and build something that's flexible and scalable. So those are kind of software-y sort of terms, but essentially what it means is you need to be able to grow over time and you need to be able to change the way you do things and adapt as you learn more about your products that you've created. Just as an example, I'm going to demonstrate this product a little bit later, but the Victorian Women's Health Atlas, I know there are a couple of people who are very closely associated with it in attendance today, so that's fantastic to see. Started life back in 2015. You know, it was a huge undertaking at the time, but if you compare it to where it is now, it was quite a humble beginning in a lot of ways. 7 years later, from just a few data sets that they started with, through investment and time and devotion to this product, it's increased to 340 plus data sets now. And they cover time periods, some up to 6 years. So there's a really rich sort of wealth of data in there. And that is credit to the investment that they've made to building this scalable architecture, to learn as you go along, and to really focus on what needs to be done to provide the stakeholders with what they need. So just a couple of notes on approaches to mapping. So the health space is a pretty complicated one. And I think from my outsider's perspective, it's sort of focused on two things. There's the provision of these services, and that's what we've seen from Safe Steps and Children by Choice. And that's what I'll describe as a map that's designed to inform. So the idea is, and Amelia mentioned this before, they don't want to be the holders of information. They want to share that information with the public. You know, there's no point having a list of people who can provide these services that people don't have access to. And so the way that the map does that is it provides that information in an informative way. And the power that a map gives you is that it provides a lot of context. It gives you an instant context. Everybody knows where they are roughly. And, you know, that's being able to make your decisions based on those sort of spatial patterns, I'll say, is really valuable to the client. So the other side of that is that when you're not looking at these sort of logistical, operational sort of questions about dispersing knowledge to people, you can also use maps and spatial data and things to make business decisions and to also educate your audience about certain things. So if you're thinking about, you know, where location, so for example, where the client is, where the provider is, you can start to imagine if you aggregate that data up, you can look at the patterns that come with that. So a very easy way of thinking about that would be, you know, if you consider people who've reported incidences of heart disease, for example, you might be able to count the number of incidences in a certain suburb. And then you can sort of start to see patterns of how different diseases and things can pattern across space and start to inform your business decisions about that. The next level, and you can keep going down as far as you want, and this sort of feeds into that discussion of business intelligence and things like that, is, you know, you can start asking questions like, how long does it take each person in this? So there's a suburb with a high rate of heart disease. How far is each person in that suburb from a hospital, for example? So how far away from treatment are they? What pathways are available to them, and how easy is it for them to actually move into that space? So it's sort of, there are quite a few things you can do, and I'd like to just take you through a couple of other examples. So we've seen the inform part, and I'd like to just show you quickly a couple of what I'll call educate maps, so educational. I mentioned it before. I'm going to quickly show you the Victorian Women's Health Atlas, now known as the Women's Health Atlas. And I'll also show you another atlas we've had the privilege of working on, which is the 4th Australian Atlas of Healthcare Variation. So with that, I will just get ready to share my screen. There we go. And there we are. All right. So just let me know if there's any issues with that share. So this is the Victorian Women's Health Atlas. I encourage you to go check it out. You should be able to find it by Googling Victorian Women's Health Atlas, or just go to victorianwomen'shealthatlas.net.au. I won't take you through in too much detail. I'll just give you a quick tour of what's available here. And just as a quick backstory as well, this application was essentially designed to replace a hard copy atlas book that was distributed to public health planners across Victoria. So the initial sort of drive for this was actually in the health planning space, but it's since moved into, well, actually a physically more educational space, because it's being used by geography teachers in Victorian curriculum. But I encourage you to go engage with that on your own time. So I'll quickly show you what the Atlas does. Basically, we've got these 6 priority health areas. So these are identified as areas that contain, useful information on health planning. And essentially what the presentation of this data is trying to achieve is to visualize the divide between men and women. So to understand the difference in health provision and health presentation and things like that on a gendered basis. And there are a whole lot of problems with gendering in a binary, but that is what it is. So if we come down to sexual reproductive health, for example, you can see we've got a collection of sub indicators underneath this priority health area. And if we click on, say, chlamydia, we can see that there are 2 different measures. So we've got the number of notifications, or the raw count, and then we've got the rate per 10,000. So we can show a kind of comparative rate of how many people are presenting in different ways. So clicking through on one of these, and we'll come to the main Atlas view. So the sort of primary component of the Atlas is the map. So the idea is to show you a really geographical image of how this patterns across Victoria. You'll see on the left here, we have quite a bit of textual information. So there's a lot of work that goes in from Women's Health Victoria to prepare this narrative information. And part of the power of the Atlas is that it is a curated view. So we're sort of giving this kind of flavored view of what we're looking at here to contextualize it even more on top of the geographical aspect of it. Of course, we have data sources and things like that are accessible as well for the user. So you'll see some controls over here on the top right. So we can change the view from the gendered view. So we can view it for the data that's being collected for men and the data that's been collected for women using these buttons up here. So it gives you a really direct way to compare the differences between the data sets in men and women. We can also zoom into a particular region. So for example, if I wanted to zoom into the Grampians region here, we can see the particular LGAs that make up that region and how they pattern. You'll also notice this chart down here, just providing a little bit of contextual information additionally about sort of rates within that data set themselves. There's one more function I'll just point out here. So this slider, we can see at one end it says 2014 and the other 2020. So that actually represents quite a number of different data sets that have gone into that, and we can actually compare them over time. So I'll just go back to 2018, for example, And looking at the women's data in 2018, we can actually see that it was a bit worse in the Grampians region. So all of a sudden, we've got this extra context of what's going on here, and we can start asking questions about why. So, for example, I would guess maybe this is a COVID thing. It could be pretty interesting if we look at the rates in 2018, as reported in 2020, dropped significantly. So that's an interesting thing. It should also be noted that over both time periods, there are lower rates of chlamydia in men than there are in women. So that's in itself feeding back into that discussion. So I'm running out of time here. I'll just really quickly get onto the demonstration of the fourth atlas. So the fourth atlas, Australian Atlas of Healthcare Variation. Again, I believe it used to be a physical atlas product that has been adapted into a kind of web mapping application by the Australian Commission on Safety and Quality in Healthcare. So I encourage you to go check this out as well. In fact, I might post that link in the chat after this discussion. If we come down here, we can, in a similar way, explore a healthcare topic. So it's set up in a similar way to the Women's Health Atlas. I'm going to go ahead and choose chronic disease and infection, potentially preventable. So it's quite laid out and structured, and we can go and see the individual measurements here. So where the atlas presented this in one screen, the Health Variation Atlas is presented it in two. I'm going to go ahead and check out the heart failure section. So we can see here that there's, again, a lot of curated contextual information around the measurement itself, which obviously the Safety and Quality Organization has put the work into preparing. But then we also have this mapping component down here. So less central than the Victorian Women's Health Atlas, but performing a similar role. And in fact, providing data across Australia. So they've put a lot of work into preparing this, and it really shows with the richness and quality of data. So not as many time series tools and things like that. This is a very time-specific atlas. So this is for 2021. But clicking on different, so this is an SA3, which is a ABS, Australian Bureau of Statistics Geography. We can start to see some of the numbers and figures that have gone into determining this. So we can see that this SA3 is actually a bit higher than the average for these in this area. So the Murray and Mallee has a higher rate of heart failure, and we can start as before examining these properties over space and over time if you end up comparing the analysis to each other. So sorry for being so quick, but I might leave it there because I think we're about on time to be moving on to the next session. So I'll stop sharing my screen and hand back over to Jarryd. So thank you very much.
Thank you, Tom. Just before we jump to the discussion, I encourage everyone who has a question to continue to pop them into the Q&A. So for those of you who are interested in the demos, we hope that's given you a bit of a glimpse into what these solutions can do. As Tom mentioned, we've shown applications that fall into those two distinct categories of being informational or educational. Yeah, and the next thing as well, when everyone who's attended registered, we asked what you're interested in finding out about. And there were a couple of people who were interested in the utilization of Aboriginal data in these web mapping applications. Now, these applications, as you've seen, can be a really great tool to acknowledge and demonstrate some of the things that need to change in order to support our First Nations people and other underrepresented groups too. We haven't dealt with a web mapping application project in that space yet, although we've done a number of projects, including a project for the Hoddle Grid Heritage Review, where we mapped out Aboriginal heritage sites. But it is definitely something where if someone has the data, it would be a very interesting project to work on. Yeah, we hope you've gained a really good understanding of the technology that you've seen and some ideas that could be used to improve your own services and hopefully achieve better outcomes for the people and clients and patients that you work with. So just to jump into a couple of the questions that have come in. So we have a question that's both for Children by Choice and Safe Steps. So feel free to jump in and answer it both. So are you generating any statistics from either of these applications for service usage by staff and or for public usage of the tool?
So I can go first. If that's okay.
Yep.
So yeah, we have an evaluation part of the map that is going to happen. It's also there'll be an evaluation for how GPs are finding being on the map and being a provider on the map, but also we're tracking how many users and things we have for statistics. But yeah, the evaluation is going to be happening soon. So it's just,
awesome.
We had to get it up and running and making sure it was all good. And then, yeah, those kind of things are coming.
I have something I can add to that as well.
Yeah.
There's actually Google Analytics built into the web app as well. So we're collecting information about what users are clicking on and that sort of thing. So there is a bit of background statistics and things that go into it like that. Yeah.
Anything to add, Rita or Paige?
Tom and I have had a conversation about that Google Analytics. I'm not sure if it's set up just yet, but that's definitely something we'll look to do, because it would be super helpful to just know like how it's been. Yeah.
And the Safe Steps product is very internally focused in terms of operational tools to increase efficiencies of operators. So it'll be really that some of that analytics will be really helpful to us to understand how our own users are using it and what's kind of showing up, you know.
Yeah, definitely. It also may be interesting to see what suburbs and what things kind of places are being put in the search.
In the search, yeah.
Yeah. So there's plenty of ways that would be very helpful.
Awesome. Amelia, we have one for you as well.
Yeah.
So are there groups in other states already showing interest in applying equivalent mapping in their context?
I am not 100% sure, but I'm assuming that potentially New South Wales would probably be interested in doing something similar, because 1-800 My Options is got a similar map, which is what we based our contraception map on for Queensland. But I am, because we're a Queensland context, it's hard for us to, we're not a national service. So for us, we can,
So I think what you've touched on there, Amelia, and to sort of add some context to that, is in Victoria, there is the 1-800 My Options, which was built prior to Children by Choice. That was built by Tom as well. And basically we've utilized a similar framework and changed it to suit Children by Choice's needs and build that for, you know, people in Queensland. And so, yeah, there's going to be an appetite throughout other states for something similar, clearly.
I think our clients, we get clients wanting like our assistance from other states, but because we only get funded for a Queensland context, we can't assist them. But I'm sure that just through that alone, I would say there'd definitely be a need for surrounding states and things like that to help get access for them, for their clients.
Awesome. Tom, I might have one for you. For an organization that has data that they're interested in displaying, they don't currently have a web mapping application, what's the process that they have to go about to get from having data to implementing an app?
Yeah, it's a good question. I think there's a lot of sort of internal reflection that needs to go into exactly what you need and what data needs to be collected. And, you know, that process is ongoing. If I think about 1-800 My Options, for example, just to call back to an application that we haven't demoed today, but it's they've been adding fields and changing the way that they collect information basically since day one. And just to come back to my point about understanding your user stories and building those functions from the stakeholder use cases, it's important to bring the data conversation in at that point, even to understand, you know, exactly what information is needed. In a practical sense, it's usually going from, you know, a spreadsheet or something and trying to sort of formalize that and put some structure around it. And you know, Paige has been through that process for the Safe Steps data. I believe she put a lot of work into developing the data there, but it's all part of the discussion and building it. So it's a bit of work, but it's something that pays itself back quickly, I think.
Awesome.
Can I just add to that one?
Yeah. Yes, go for it.
I was just thinking about like kind of how we built that concept of needing a map and things like that, because we have our internal system that would have been looking at the location of our clients, and we can see that they're really having to travel quite a long way to get access. So say if you are up in North Queensland, sometimes to get a surgical termination, you have to come down to Brisbane. So I think as a reflection of our service, we were realising that people were going to have to travel a long way. So it's good to see what kind of options are around them, and that's where that map can be that first point of call. And then if it is a long, like a far journey, it means that they can call us and really strategize. But it's in that reflection as a service going like, well, we don't have a lot of providers out rurally, which was really done through our rural remote project that was finished last year by a project officer called Rachel. And so I think that was the real reflection to really need the map, and that's how that came along within that grant.
Awesome. Thanks for adding that, Amelia. We might stop there because I realise it's getting close to the end and some people may have to duck off. So any unanswered questions, we'll reach out to the people and provide some responses to those. So if you'd like to learn more about any of the content presented today, as I said, we'll send out a follow-up email and you can reach out to Tom, myself. We'll put our contact details in the email, and we'll also provide any information shared, so maybe links to the applications where they are public and available. Otherwise, I'd like to take this opportunity to thank Rita, Amelia, Paige, and Tom for their insights. And I'd like to thank you all for taking the time out to present. I'm very happy that you were willing to do this today and talk about this important topic. So to everyone else, we hope you found this session very interesting, and we hope you enjoy the rest of your day. Thank you.